Hi everyone, welcome to today's wellness session. In today's session, we're going to continue our conversation about depression. And this week we're going to focus on depression in children and how that presents. A couple weeks ago, our first session on depression, we talked about the behavioral characteristics of depression. In last week's episode, we talked about how depression presents in teens. And we talked about how the primary characteristic tends to be anger and frustration, irritability, things like that. So in today's session, we're going to review some of the main characteristics that present in children and talk about how that looks different from the behavioral characteristics that we see with teens. Some of the main characteristics of depression that present in children are those feelings of sadness, negative thoughts, thoughts that trigger negative thought patterns like, I'm never going to be good at this, or I always mess up, or I can't do anything right. Those kind of thoughts that trigger those negative thinking patterns. Changes in eating and sleeping patterns. Physical complaints like aches and pains. At school, that might look like a student requesting to go see the nurse a little more frequently. You may also notice a lack of energy. Depression for anybody, but particularly children, can be very draining. So they may seem like they don't have the energy to even do small or minor tasks. You may also notice a decrease of or lack of interest in the child wanting to participate in fun things or things that they used to find enjoyable or like to do. So as you can see, some of the characteristics that typically present in children experiencing depression are more of those internalizing characteristics. As we discussed last week, depression is an internalizing disorder that affects our emotional personal life. So whereas anger presents more in teens with depressions, we oftentimes see anxiety present with children that are experiencing depression, so that those self-critical thoughts that trigger those negative thought patterns tend to trigger anxiety and or that fear and worry within children. This could look like a student or child not wanting to leave their parent to go to school or daycare or any other kind of function. Or it could even look like a child just getting noticeably worked up prior to participating in a new activity or assignment or something they haven't done before. Let's talk about what can cause depression in individuals. So one indicator that an individual may be at a higher risk for experiencing depression is if it's hereditary. And what we mean by that is if it's in their genetic makeup that they get from their family, like their eye color or their height. So a family member may be experiencing depression or have a diagnosis of depression. Other indicators can be situational. What we mean by this is major life events or changes. This can include death, loss, a diagnosis of serious illness, divorce, a move, experiencing homelessness, financial distress, or any other kind of hardship. These are all examples of more negative major life events or changes, but even with positive life events or changes, any of them that are major and may cause stress could also lead to depression. And this can include things like weddings or a birth of a child or a sibling. Even a move can be considered a positive change, but still trigger depression. As you can see, depression in children and depression in teens looks different. When we talk about children, we typically mean under the age of 12 or an individual that has not experienced puberty yet. So let's talk about what you can do if you feel like your child is experiencing depression. The first tip is to talk to your child about their thoughts and feelings so you can get a better idea of what they're experiencing. You may also want to even talk to them about thoughts and feelings associated with depression because they may not understand. The next tip is to get other adults involved. So this would be adults that are involved in your child's life on a regular basis. This might look like a teacher, coach, club sponsor, youth leader, a family member, or any other adult that your child spends time with on a regular basis. And you want to consult with them, let them know what you've recognized and ask them what they're seeing, and come up with a plan to best support your child. The next strategy is just to try to intentionally be patient and kind when your child is experiencing signs related to depression as you work through these behaviors together. And the last tip, I just want to encourage you to schedule some kind of enjoyable activity to engage in with your child. Something fun and relaxing, even if it's just getting outside and going for a walk or doing some kind of craft together. If you feel like the symptoms that your child is experiencing related to depression is affecting any area of their life, this includes their home life or their ability to function at school, or even their social life or their social interactions, I encourage you to consult with your child's doctor for further recommendations. I hope you found this information useful, and this concludes our series on depression. Next month is Child Abuse Prevention Month. So in our upcoming session next week, I'll be talking about child abuse prevention. Thank you for joining today's session, and I hope you'll stay tuned for our upcoming sessions.